Hello. So you'd like to be a health economist? Well, what exactly is a health economist? Well, at its core, basically, a health economist is looking at the healthcare system and interventions in the context of how can they improve health and healthcare, and also what is the value, i.e., what are the costs associated with delivering the care. So I think it's a really exciting profession because you work with a whole variety of people, both from the decision maker level at government kind of decision making, and you also interact with different kinds of disciplines like biostatistics. You work a lot with clinicians because in health economics, you're working with clinicians because it's about health. You work with patients and you work with academic colleagues and also people who are running the healthcare system. So in our case, Alberta Health Services, people who would be responsible for managing and delivering healthcare services. So there's a lot of variety in health economics, and there are lots of opportunities to specialize. So I'm Deborah Marshall. I'm a faculty member in the Department of Community Health Sciences here at the University of Calgary. I was recruited here 8 years ago, and I hold a Canada Research Chair in Health Systems and Services Research, and also the Arthur J.E. Child Chair in Rheumatology Outcomes Research. So let me give you an example of what a health economist, health services researcher does. So here's an example where we've mapped out the entire care pathway for osteoarthritis. So this is a chronic degenerative disease, and a lot of people will have this disease in the future. One in 8 people approximately will be having osteoarthritis. So we've mapped out here from the very beginning of developing the disease all the way through self-care management and referral to specialty care and end-stage diseases through to surgery if somebody would need it, and their management thereafter. But what's really interesting about this is essentially we have identified how people will flow through the healthcare system, how long they'll spend in each stage of care, how many resources they will consume, and what type of resources they will consume, both in the delivery of care and accessing different kinds of healthcare providers. So we can take this essentially and use it like the equivalent of a NASA flight simulator, where we can figure out and project what will be the needs for the healthcare system to provide good quality care for patients in the future. So we can help create and map out the future of healthcare, in this case in Alberta. So that creates huge opportunities, a lot of diversity, and if you're interested in both qualitative and quantitative methods, I think you have an opportunity to challenge yourself, to apply a variety of skill sets and work with teams of people to try to improve care. And maybe one day you'll need it as well. So you can actually think about it as planning for your future. So if you're keen, hardworking, and would like to make a difference, I would urge you to think about health economics and health services research as a career path.